My name's Kathy Ballman, and I am the coordinator for the Adult-Gerontology Acute Care Nurse Practitioner program. I've been doing this for more than 12 years at the University of Cincinnati. I've worked as an acute care nurse practitioner in a few different places. My original RN experience has been more than 30 years of emergency department nursing, and during that time, my favorite patients were the cardiac patients and the trauma patients. So when it was time for me to move along with my education and my career, I decided the acute care program was the one for me. Once I got out of my program, I worked part-time in the emergency department as an acute care nurse practitioner and full-time in heart failure. And currently, for the last 13 years, I've been at the University of Cincinnati Cardiovascular Institute working as a nurse practitioner part-time while I'm teaching. So it's been extremely rewarding. What you have to think about when you're considering what type of program you want to go to, what type of role you want to have. And the nurse practitioner role when it comes to acute care is taking care of the critically injured, the critically ill, the unstable, and the chronic patients. So you have a pretty wide variety of patients. And then there's multiple areas that lend themselves to having an acute care nurse practitioner. It can be service line, such as perhaps a hospitalist service or an intensivist service. It might even be something like endocrine, and you might specialize in diabetology, or it could be nephrology or neuro. Neuro, you could be in neurology, you could be neurocritical care. It just depends on what your interest is in. The other thing you can do is work in different units. So you may have an intensive care unit that has surgical patients or medical patients, and you're basically the NP service for that unit. So there's a wide variety out there when it comes to what type of role you can play. So when you're thinking about what you want to do or what type of specialty, you have to think about what your ultimate goal is and the type of patients you want to care for. While none of the NPs use site-specific, I do have to say the majority of NPs that come into the acute care program at least work part of their time in the hospital setting. Such as my service in cardiology, you may work in the hospital with the EP group or with the intensivist, or maybe even just consult. And then another time you may be working just in the clinic or in the stress lab. So, there's a large variety out there when it comes to areas of practice and sites. The program itself is there are multiple areas of the program. We have the traditional master's program. It is full-time 2 years. It can also be done part-time, and it has to be completed within 5 years. We have the BSN to DNP program, which is 3 years, or it can be stretched out longer as well for those that require part-time. Also, we see a large population of NPs out there that want to come back and get more credentialing. So perhaps the FNP or the primary care NP is interested in changing their scope of practice. We have them come back for postmasters, and I take a look at the person's experience and their coursework that they had in their original NP program, and then we develop a schema for them individually. Also, you need to know that when it comes to nurse practitioner education, there's core education. So the core of the NP program is pretty similar to that of the FNP and the adult primary care, but there are specialty courses in the acute care program, and my program is on site. So there's requirements to come to campus pretty much once a week for close to 2 years. So that's important to know. The specialty courses have to do with how you take care of that critically injured or very sick person, such as someone who has exacerbation of COPD or asthma, the MI, the trauma patient, some unstable stroke patient. That's what we're going to take a look at when we do those classes. The classes are a combination of didactic and of lab. Our labs span from taking care of the basic airway to doing intubations to doing chest tubes and needle crikes. We have labs on suturing and how to use ultrasound, how to do LPs. We also have the wonderful fortune of teaming up with the folks at UCMC, and we have a cadaver lab. So that's usually one of the highlights of our program.